Well, I think there's an enormous role to play by the Red Cross. Firstly, because of its principles, particularly humanity and impartiality, which should be a driver, like an engine, to reaching out to those communities that are most vulnerable to HIV and that are also marginalized by society, can hardly find the support that they need in a state that criminalizes them in many cases and marginalizes them. So really there's a motor there in its principles for the Red Cross. There's also a very important value the Red Cross has, which is the Red Cross and Red Crescent emblems, which are very powerful as well. I remember the very early involvement at the beginning of the 80s of the Red Cross with people living with HIV in industrialized countries, here in Europe in the early 80s, when it was nobody wanted to be seen holding, walking in the street with a pamphlet that said AIDS on it, because you'd be seen as gay and you'd be seen as being infected with HIV. Nobody wanted to allow the room to be used for meetings of people living with HIV. And all the Red Cross did was put its emblem on that same leaflet, allow the people to meet in its offices. And suddenly that protective power of the emblem became very apparent. It was safe to be seen at these meetings. And the third aspect, which is very important for the Red Cross, I feel, is the reach it has into communities. It's everywhere, it can reach everywhere, and HIV is everywhere. The Red Cross volunteers a formidable force for that. I can't think of really how we're going to get the scale of community interventions we need to defeat HIV if it is not with the help of the Red Cross. So there are two important roles, I would say, for the National Society. One is around service delivery. The other one is about changing policy and the legal frameworks that criminalize these populations. In terms of service delivery, there are lots of statistics that show that communities that are marginalized and vulnerable to HIV are not receiving services, they're not able to access services that would make them less vulnerable to HIV, either because of political reasons, the money doesn't go to them, or because the stigma and discrimination is just too high for them to access mainstream services. The National Societies can be really important players in either providing services directly for these populations or making services that already exist more open to access from these populations. And the second area, as I mentioned, is policy change, is changing the legal frameworks that criminalize these populations. We've seen the Red Cross already playing an important role around harm reduction, around changing environments that make it very difficult to prevent HIV infection amongst drug users. The Red Cross and Red Crescent societies have taken, in many cases, a public health approach, one that is rights-based and based on its principles, and produce changes that make access and prevention services to these populations much better. But also I think it's partnerships with sex worker networks, with MSM networks, with networks of people living with HIV, and I know some they are already happening, but if we can really take those further, we'll have a movement pushing from within inside the Red Cross movement, but also partners pulling and guiding from outside, and I think that would be the bold move that could be done in the next year.